The state of Telangana has seen a lot of controversy about transparency in data, whether the government is being honest enough about what data is being put out, what's the true picture of number of cases, why is it that the testing was so low for the longest time. But now Telangana has also begun to ramp up its testing. More labs are being allowed, more hospitals are being included. So there are some steps that the government has taken as the cases began to rise in the last 1 month. Here is the takeaways basis our own projections for Telangana, that the increasing R0 is a worrying sign even now for the state of Telangana. While other states are seeing improvement, in Telangana, R0 is actually going the other way around. In fact, it was 1.2 in the month of May, around May 27th. As of July 7th, it's gone to 1.42. To reiterate, R0 is a reflection of how many more people can one active case, can one infected person further infect. And that really shows you how much the infection is spreading and how quickly. Also, Telangana's rise on a daily basis is putting some amount of burden on the healthcare infrastructure. So that is something that needs to be watched out for. Its peak date is likely to be July 29th. It's likely to hit about 20,000 cases by July 24th, and then by 24,232 cases by July 29th. And hopefully after that, the number of active cases will begin to come down, which means there will be more people who will be recovering than the number of fresh cases that the state sees on a daily basis. Let's say good evening to the panelists who are joining us. Mr. Sriram Karvi, resident editor of Deccan Chronicle, and Paul Marks, national media spokesperson for TRS. Let me go across to Mr. Sriram first. Mr. Sriram, give us a sense of what's changing on ground in Telangana now. What is it that you read from these numbers and basis what you're also seeing on ground?
Tanvi, when I saw the projections you made, I felt very relieved given the somber, despondent mood there is in Hyderabad and Telangana right now. If your number hold true, people will be very, very, very relieved. What has gone wrong in Telangana from the word go? If I may describe their strategy, it's been maverick, a kind of Witherspoon, counterintuitive. First thing is they showed a very, very asinine kind of obduracy, if I may say so, about testing. They said, if you don't test, nobody will catch coronavirus. That was the mindset. You rightly pointed out that there is a great emphasis. Early days, maybe there was a sense of premium on kits, on utilizing it well. So there was a lot of clinical, attestation being done before you used diagnostic approach. But basically, the government of Telangana has refused to test. They would not refuse asymptomatic people. They would not refuse relatives and family members of those who have been found positive. They refused to test the dead. And as a consequence, the containment management collapsed. Hyderabad had many zones. They kept changing it. It was a colony, then a street, then a building, then a flat, then one room in a house, etc. The entire concept of contact management collapsed. All this is because of some larger fault lines in our polity. One, Telangana, which has about 4 crores population, about 1.1 crore live in Hyderabad, greater Hyderabad area. So it's one city that's more than 1/4 of the state. So the city is very crucial to the health of the entire state. For 10 days ago, the chief minister, the office announced to the media that they'll announce another lockdown because the cases moved from 500 a day on an average to 1,000 to 1,500 to now we are at about 1,800 to 1,900. And don't forget, at 25% positivity rate, nobody believes that these numbers reflect reality very well. For a number of reasons, the biggest one of which is the government is refusing to be transparent. A case in point, the neighboring Andhra Pradesh has tested over 1 million people, nearly 10 times more that of Telangana. And it's not a case of financial resources. Hyderabad has been called the healthcare capital of this country. We used to plan for medical tourism where patients from Africa, Middle East could come and get surgeries done. This is the kind of city we are talking about. The decisions of the health ministers to say one government hospital is where everybody will have to go. It put immense pressure on that hospital. You did not prepare other hospitals along lines of COVID, non-COVID. So as a consequence, what's happened, anybody who's not suffering from coronavirus, but something else, heart patients, lung patients, they have no healthcare access. Today in Hyderabad, with all the money you have, you cannot get into a private hospital without recommendation. They talk about creating a world class infrastructure called TIMS, which was an existing building. The first doctor has not seen the first patient in TIMS. The home minister is unwell with coronavirus with some of his family members. He's joined a private hospital because he doesn't trust his own government's world class hospitalization. They've done flip flops on private labs. They've allowed labs to test. They see the numbers go up. They're playing this very bizarre race in their mind of saying somehow Telangana should be the state at the end of this corona epidemic with the least number of cases, no matter how. Be it in lack of transparency, be it cheating, be it fudging numbers. The template on which they report has been changed 17 times in the last 50 days. And may I say, this is a state where the citizens, for the last 10 days after they said they'll do a lockdown, which instantly meant a lot of people left from Hyderabad, went to the districts and villages, and the spread of the coronavirus in the villages has gone up. This is a state where people are asking, where's the chief minister? The
Okay.
government seems to have relinquished, and the governor seems to have,
Yes.
in de facto, taken charge of this government. That is the kind of failure, unfortunately, Telangana has become in this fight against COVID in the last 100 plus days.
Well, Mr. Sriram, very clear, sharp points that you've raised right now. And I think the numbers are a reflection of some of those points as well and those reasons as well. So let me ask Mr. Paul Marks. Mr. Marks, what's going wrong? Is it that you were simply refusing to test earlier or give us the data earlier? But why is there a sudden jump now?
Yeah, good evening, everyone, and good evening, Mr. Srinivas Garu. So what I am saying is, as the figures you have projected, I agree, there are some mishaps from the government, but it doesn't mean that we are not doing anything regarding the corona. So whatever we have done in the past, we have ramped up the COVID testing. So before it was hardly 2,000, now we have increased to 6,000 to 7,000 COVID testing in the state. The surveillance system is in place now, and we are taking all the containment measure. You see, out of 7,000 cases which are reported now present in the state are in the containment, and we are giving proper care to these containment persons. And apart from this, we are also taking measures to go for the hospital preparedness. So in fact, I agree with you, there are some loopholes in the state and government hospitals where the problems are the doctors themselves are not coming for the screening. They are hesitating. So we have to increase their morale so that they doesn't leave the corona patients, because in the past you have seen many patients making the selfie video of the infrastructure that is present in the government hospitals. So that we are taking proper care, and we are motivating them with the constant workshops or the increased awareness among the doctors. So that care we are already taken off. And as you are talking about the central government or the efforts and the state government efforts, so we are on par with the central government what it is directing, and we are on par with the ICMR guidelines. It is not that we are not onto the par of the ICMR guidelines. We are giving proper care round the clock to the right person and with the right care. And if you ask me personally, what I opine to you is, see, the present situation, the magnitude with which the corona is striking you now is far exceeding the state efforts, any state government efforts, and Telangana government is not an exception to this. So you have to understand the present magnitude of the COVID striking
Mr.
us.
Marks, Paul, you
Yeah.
are highly mistaken there. States like Delhi, Gujarat, Maharashtra are actually have managed to get quite a grip on this situation. Delhi and Gujarat have seen quite a bit of a turnaround. Mumbai has seen a significant turnaround, even if other cities like Pune and Thane continue to be a challenge. So it's not to say that everybody is going through the same phase. Karnataka, which was doing very well, has suddenly now seen a spike because they let down their guard. In Telangana, everybody seems to be asking this question: where is the government and where is the transparency in what's going on?
See, as a government, our responsible. Where is the government? You have asked me. It doesn't mean that we need to address to the media regularly, and we need to portray ourselves that we are doing much care, because our actions speak more than what words we tell to the media. So we have. It is not necessary to gratify all the criticism we are getting right now, but whatever loopholes were there in the past, that we are trying to rectify it, and we are taking care to give good care to the patients. That present we are doing now. And as far you ask me, like, what is the state government doing in the state-run government hospitals, and uh, like, why the state missionary is going to the private hospitals for the treatment? So I'm telling you that in fact, if you understand the present situation, there is panic among the all the citizens that if they go to government hospitals, they uh, will worsen their condition. Their condition will become more critical if they are coming in contact with the COVID patients that is presented to the government hospitals. And if they are by chance going to the private hospitals, they are looting
No,
and
that is
exploiting.
absolutely true. That is
Yeah,
absolutely true. We highlighted repeatedly what has happened in one of the biggest hospitals in Hyderabad, the kind of chaos that's gone on there because they've not been able to manage the caseload there. I understand. I also appreciate that you admit that there have been few, problems, few loopholes that you are now trying to plug. I am completely out of time. So, Mr. Sriram and Paul Marks, thank you so much for joining us on the conversation. We continue to keep a very close track of what's happening in Telangana.